Welcome, everybody. My name is Marty Mascari. I am a contractor under the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. Both of the organizations are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. So we have the primarily the surrounding counties around Dallas and Tarrant County. Tarrant County is Fort Worth, Texas. But we invite anybody and everybody who would like to join on any of our webinars to join in and get the information and hopefully share it with people that you know that and especially when we get into Medicare that it might help whether you live in our service area or not. We're thrilled to have both our cohorts with the Area Agency on Aging and our partners at the Better Business Bureau Education Foundation, the Houston chapter, with us today to talk about midweek Medicare, how to use the Medicare Plan Finder, and open enrollment do's and don'ts. But before we get started, I am going to talk about the CEUs. For those of you that are joining us today looking for CEUs, we're providing CEUs for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process, get a certificate, submit it to your jurisdiction, but just know it's up to them whether they will accept it. I have had people write me. I don't know why the one that sticks with me is if somebody from Ohio wrote on here in the notes one of the webinars that they've even been able to use it for their license in Ohio. So I do encourage you to get one and submit it, but there's no guarantees. I have had jurisdictions reach out to me for more information on a webinar in order to determine whether it meets their standards that they're looking for CEUs for their licensees. Today's webinar is worth 1.5 hours CEU credits. You must complete the entire webinar and the live Q&A up to the advertised time, which is 11:30 Central Time to this morning. You must also complete the Google evaluation survey. That survey should pop up as you close out of Zoom today. It should ask you if you would like to take a short survey, and it will take you to our Google survey. If it does not pop up, which some companies and people's computers are set to not allow pop-up or have pop-up blockers, you will also receive that in a follow-up email, but that will not go out until tomorrow and probably late tomorrow. You find out I end up getting them out late in the day or even into the evening, but it will go out sometime tomorrow. The Google evaluation survey will be available for a little over a week for you to complete, and then give us about a month to get the CEU certificates emailed out to you. And just know I have been out of town. They're really difficult to do when I'm on the road, and so I am behind. I don't think I have sent out the ones for last month yet, but next week I'll be doing a lot of catching up, hopefully with CEU certificates, since I'll be back in my office. So I am going to stop sharing and turn it over to Felicia and let her share.
All righty, give me a second.
Felicia,
go ahead.
With the Area Agency on Aging as well, and she is going to present on how to use the Medicare
Plan Finder.
Thank you. For some reason, that just wouldn't come to me. For some reason,
that's okay.
Maybe
that's okay.
I'm wiped out. Okay.
I understand, Marty, and we will get this going. And let's see. There we go. And let's start.
And thank you, thank you, thank you, thank you for all of you joining us.
Yes, thank you. We are grateful for you being here. So everyone can see my screen and everyone can
It's
hear me.
showing, it's showing the side screen too. I don't know why. It's showing the little, the big
Oh,
screen,
okay.
and then your next screen is showing for
And
some
that
reason.
I was afraid of that. So let me
I
see
think
if I can
I
fix
should know the
that.
fix to that, but
It's not, let me,
Maybe stop sharing, excuse me,
yes.
and share your other screen.
Okay. Let's get this going. So sorry. Let me,
it's all right.
uh,
Just doing fine.
let's see what we can do and share this. There we go. Is that better?
Now it is. Now we
All
got
right.
it. Thank you.
Yay!
Yay!
So again, welcome everyone. We are so grateful that you're here, and I will turn my camera back on so you can see me. There we go. Awesome. Here we go. All righty. Let's just get into this. The Medicare Plan Finder. We're going to talk about that. But I am Felicia Warner, and I'm with the Area Agency on Aging of North Central Texas, and we're with the North Central Texas Council of Governments. We are known as SHIP, and I will explain more of that shortly. But we also partner with the Senior Medicare Patrol to provide information on fraud and abuse, and we are co-presenting today with, I believe, Jennifer, but correct me if I'm wrong, about
That,
open enrollment do's and don'ts. Is that right? With
that is
You
right.
got it.
all right. And Jennifer, we're excited to see you today. So I'm not going to take up a whole lot of time because I know, Jennifer, you have wonderful information also on the do's and don'ts of open enrollment during Medicare, because I'm even excited to hear about it because you are always on top of this, and I really appreciate it. But our
No
main bit,
pressure. No pressure. Why are you putting pressure on me?
but this is our main benefits counseling team, uh, Leslie and Simon, and our fearless leader, Melinda Gartner. We cover 14 counties, and we try to get out information that's timely and accurate to our community members. It's so important. SHIPs are federally funded. The SHIP program was established by Congress, and their work is funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. The SHIP can help you. Oh, and I can go on and on. We work with the state and local agencies and, I'm sorry, state offices and community providers to get information to our community members. And we can help over the phone, in person. We can make group presentations. We can use a variety of media sources to educate people about Medicare. And also, we'll never forget, even though we have all of these tools to get information out, word of mouth is always helpful. When a beneficiary contacts their local SHIP office, a certified counselor will give them a one-on-one guidance on their unique situation and their needs, and SHIP also helps them understand the cost and coverage by comparing options and completing. We can also complete the enrollment process. SHIP, and this is also so important, we provide unbiased information. We're not selling anything. We give information. The beneficiary makes that choice on what is best for them. And as I always say, not best for what's what your sister has who lives in Arizona or something. But again, everyone, thanks for taking out time from your busy week for this Medicare midweek Medicare presentation. Hey, it's almost Friday, which means it's the weekend. Yay! The North Central Texas Area Agency on Aging provides free services for older adults and their family caregivers. Please call us for more information. There's our number on the screen. And again, you'll get a copy of these slides so you can have that number. The Aging and Disability Resource Center helps people get connected to services. It also assists people with finding agencies that provide caregiver respite, home delivered meals, in-home services, and much more. As we all know, volunteers are so essential to our mission and vision. We again serve 14 counties here in North Texas, and our efforts are always enhanced by our volunteers who increase our reach. They uplift our visibility, and they are highly effective, efficient, and highly trained. These are some of the 4 areas of volunteer opportunities. The benefits counseling helps provide information to our community members, of course, about Medicare. The Senior Medicare Patrol helps prevent fraud, abuse of our most vulnerable community members. Long-term care ombudsmen are instrumental in protecting the rights of those who are oftentimes unable to speak for themselves. Our evidence-based programs that can assist in managing chronic illnesses and reduce your risk of falls that can put you in a nursing home, hey, or even worse. So those are some excellent programs that we offer. And really, our volunteers get to choose what suits them best. The training gives an individual the confidence, and you are enhancing really skills you already have learned in the workplace, such as communication, listening, relationship building, and also, most importantly, it's understanding your own values, what you already have. You have respect and compassion for our elderly and disabled community members. And I'll skip over that little video because I did not include the sound as I've done in the past. I always forget about that. But if you get the slide deck, you can listen to the video. And this is how people help your community by volunteering for SHIP. And I apologize for that. Don't get me, Melinda. All right, open enrollment starts October the 15th, which is next Wednesday, and it ends December the 7th. And this is one of my favorites during open enrollment. You can join, drop, or switch another Medicare plan. You can switch from original Medicare to a Medicare Advantage, or from Medicare Advantage plan to original Medicare. You can drop, join, switch, all that during open enrollment. And the plans take effect next year, January 2026. And here is our meat of our presentation. It's the Plan Finder. In this presentation, I will definitely try to explain some of the updates and improvements to the Medicare Plan Finder, and then go over some older ones that were in prior years, 24, 25. And we'll just go through all of that, and we'll just start by the Plan Finder improvements, the prescription, Medicare prescription payment plan, the Part C, and the special enrollment periods. We'll just go an overview, and I really want to stress the Plan Finder can help you do so much. And the reasons to use the Plan Finder is to find and compare plans. It's can do the personalized cost estimates. You can evaluate your plan. You can compare different plan types, and the enrollment has been simplified. It's mobile friendly, accessible. It's there 24 hours a day, 7 days a week, and you can avoid surprise out of network billing, and you can choose a plan that includes your current doctors. But again, and I'll say this again throughout the presentation, make sure you double check to make sure they're in your network if you choose a Medicare Advantage plan. So of course, there's the Medigap plan, and those are for people, if you have a spouse or a roommate, you can often get a discount. So there is something on that page with the Medicare.gov that if you're looking at a Medigap plan, you can get a roommate or a spouse discount. So look for that if that applies to you. And important is the pharmacy finder. You know, it's all going to be in there. You can look for your in-network providers for your prescription drugs. And this helps with estimating how much you're going to spend. How many of us are not concerned about how much we're going to spend? So this plan finder can help you do that. And also with the plan finder, this is the results from this section, and it's the drug coverage sections of the plan details page. Again, more on that. And you can also put in there your current location. You can use your home address, or it can make another suggestion on another pharmacy. I like to use the example, my daughter lives in another city, and if I were ill and I had to have a prescription picked up and I just couldn't get out and drive because I would be a threat to the whole world. I'm ill, I need to stay at home. I can put her a zip code in, and she can find the closest pharmacy to her workplace, and then she can bring the prescription to me. And that would save her time and also keep the world safe from my driving. The Plan Finder filter improvements, which are a great source to use. The updates are aimed at reducing decision overload and feeling overwhelmed, and make the plan results filters easier to use, which is so important. You can narrow the number of price plans down to what you can deal with, maybe 3 or 4, so you won't have that cognitive overload trying to figure out everything. And there is increased discoverability for the special needs plans for potentially eligible users. So those are one of the best things that they're trying to do. And it helps users understand how their choices will affect their search results. And there are drop-down boxes, as you can see, to help you filter out what you don't. You just don't want a whole bunch of sites that you can go to and they're not close. Or unless you're working and you want to conveniently pick up a prescription on your way home. And here's some more Plan Finder filter improvements. The style link is a primary button to use that. And so the Inflation Reduction Act provided some more coverage in eliminating the coverage gap phase of the Medicare prescription drug plans. The out-of-pocket spending was $2,000 last year, and now it is $2,100 starting in January 2026. And that will move directly from the initial coverage phase to the catastrophic phase, and the plan details and enrollment confirmation pages will be updated to show that. You can see that all on the plan finder. So the Medicare prescription payment plan. And I don't mind telling you that my husband takes a expensive medication, and this is a wonderful tool to use. So the Medicare prescription payment plan and the Medicare plan finder, it's estimated that about 70% of beneficiaries do not compare their coverage options. 69% do not review their plans. And while only 31% did, and that's a lot to know why people don't. So we are committed to getting out into the community and getting this information that those individuals who are not looking over their plans, we possibly could save money. And again, the $2,100 cap for those who are enrolled and who will enroll in a Medicare repayment plan. So the plan is not to save you money or to lower your cost of your drugs. It's to help you manage your money better. It's for individuals with consistent, manageable drug expenses that are, this program wouldn't benefit. It's for those expensive drugs that you have to take on a regular basis that the Medicare prescription payment plan will assist you. And also I need to add, you don't need to do anything but call your plan, make that arrangement. They'll send you some paperwork, you'll sign it, and they'll bill you over the course of the year a payment that you can manage instead of the enormous amount you used to have to pay before this was initiated. And here's some more information about the Medicare prescription payment plan. And it started in 2025. And if you are enrolled in that Medicare prescription program, repayment program, and you keep the same plan, you don't have to do anything for the next year. You're automatically enrolled again. But as I'm going to say continuously throughout this presentation, always check with the plan to know what your payments will be. This again show payments, what you'll be paying, but this is just the Medicare plan finder, but call your plan to find out how much your payments will be. And there's some more, and of course you'll get these in the, Marty will send out the slides, but a word of caution, at the end of like 9 months, that probably wouldn't be able to enroll in a prescription drug plan in the first, I'm sorry, in the last quarter of the year. And here's just another kind of overview. And when you're looking at a plan and you've put all your medications in, if your prescription is not covered by the plan, you're not able to use the Medicare prescription repayment plan. And those for individuals logged in with their Medicare, you can see the plans, you'll get a message that the payment plan information will be added on there. And also with the dental and hearing benefits, again, check with the plan if you choose this, and make sure you understand that all of those, the hearing aids, the dental benefits are for you, and that you can understand what benefits are available to you. And on the plan details, just if you have questions, just kind of write them out and then call the plan to make sure that that is correct. And here's plan finds, just showing you a little bit about it. There's the checks, you know, if it has a red check by that, you understand that you will not have that benefit. And here is some of the dental and hearing benefits. And you can see that on the plan, and you can compare that also. Hearing, dental, preventative dental, and comprehensive dental. And there are the subheadings and what you are allowed and what's not. So pay close attention to that if that is something that you're interested in. And there's another, the current hearing, preventive dental, and comprehensive dental. And this is the Plan Finder special enrollment. This section highlights the special enrollment periods with the Plan Finder, and I'll go over those. Individuals during the first year of the Medicare Plan Finder, Medicare Advantage Directory, CMS will grant a special enrollment period. This is something they've just started for individuals who rely on the Medicare Plan Finder for information. Enrolled in a Medicare Advantage plan through this, the Medicare Plan Finder, and you discover within 3 months that your preferred provider was not actually in the Medicare Advantage Plan Finder network, there is the special enrollment for that individual. And this is only temporary, and you will only be able to change because the information on the Medicare Plan Finder was incorrect. And you can change that between January and December of 2026. And of course, if you relied on that only for your information, and you can make that change, but after that, you wouldn't be able to. And then adding a monthly Medicare drug plan, special enrollment for people with Medicare and Medicaid, and adding a monthly integrated care special enrollment for people with Medicare and Medicaid again, and retiring the quarterly Medicare dual eligible special enrollment period. And we discussed the special enrollment for the information on the directory if it was incorrect. So I will attempt to do a live demonstration. How are we doing on time, Marty?
And I don't have y'all timed out. It's 10:34, so you're 34 minutes into it.
Okay.
But the
So-
first 10 minutes was me, so you're only
Okay.
25 minutes into yours.
All righty. So we're going to go to the Plan Finder. No,
Well, you're working on that. Could I ask Melinda? Melinda, could you get a silver alert put on Felicia's car so we know when she's sick and she's not on the road?
I know it. It's
That
awful.
we don't get
It's
on the
awful.
road.
It really is. When I had COVID, I went to because I didn't want my daughter to be around me, and I went to sleep in the drive-through, and I
Oh.
was so outdone. I was
Mhm.
so tired. I really was. And it was incredible. Everyone see my screen?
Yes.
Yes,
All
we can.
righty. Thank you. Oh, I was so sick. I was miserable. And well, anyway, here we go. That's, that's the live demonstration. Okay. I'm not going to take up too much time, but anyway, let me get to, I'm having some difficulty going in between. That's not working. All right.
Okay.
Do you all see that? The
We're
Medicare?
seeing Medicare.gov plan
Awesome. All right.
dash
Thank
compare.
you.
Mhm,
That's the
mhm.
one.
Okay.
Okay.
You're good.
All right. Here is the website. And it's really, it can be daunting, but play around with it. There's nothing you can do. You won't blow it up, as I always anticipate. It's a pretty steady website. So I put in 76001, and that is Tarrant County. And I'll look at the Medicare Advantage plans. And it asks, and these are very important questions. Do you get Medicaid? Do you get supplemental security income, Medicare savings program, extra help? And no, I do not. And do you want to see drug? And I'll just do one, and we'll put in, oh gosh. Oh, I can't spell. All righty, here we go. And say you take 10 milligrams, you take it every day and you add it. Really easy breezy. And you've done, then you choose your pharmacies. You want to choose them however you want. If you're still working and you want to have the convenience of picking it up at uh, a pharmacy that's close to your job, you can do that. But it allows you to add 5, and I'll just go really quick right that. And then you have them listed there, and then you continue to view plans. And these are the filters. And if you need to special needs plans, you can click that and it'll put that to yes. Plan, health plan type, plan benefits, insurance carriers, drug coverage, and then view all plans. So Health Springs preferred MO. And when we are talking with clients, I'm sorry, I hadn't put my camera back on. You can see that this plan, HealthSpring, and here's the ID number, the star ratings were coming soon. The monthly premium is 0 for that prescription. You would not pay anything for it. And then your health deductible, your drug deductible is $200, and hopefully you'll never reach that with this generic drug. And you have a 3,400 in network. And this little line, you can click on that and it'll tell you, here's the plan details. You can click on this to compare others. And I'm sorry, I'm going through this real fast. You have vision, dental, hearing, and transportation benefits. And you can click on this to see more benefits. They have over-the-counter drugs, the worldwide emergency, but telehealth, and all of that. There is 0 copay if you see your primary doctor, $15 for a specialist. And then to just wrap it up, we'll view the drugs. And since it's only one, these are all of the monthly premium. Of course, your premium for your Medicare, you have a 1 by that, that's going up. So deductible, there's your drugs, maximum, and specialist. It just lists everything. So that's why I always suggest having a little pen and paper and just jot down questions when you call the plan, and you'll have your questions there to be answered. So a big thing is ground ambulance service, $230 copay, and then always see the limits apply. And then just go down and you see this drug, this lisinopril, Walgreens 0, Walmart 0, DFW Wellness would never ever go there. It's $347.28. And Simple RX is $13.80, and then the mail order is 0. And these are your preferred pharmacy. This is in network. This is out of network. So you would never step inside there and get your prescription. I'm sorry, you just be, for me, it would be like hitting my toe. And you just go through this and play with it and explore and have fun. I'm going through here real fast. But this is the Medicare Plan Finder, and we can go back. And we can go back to look at drugs. You can just bounce around in it all you want. And look at other plans. Baylor Scott and White, Health Springs, and it's unlimited. So I can't say enjoy yourself because it is kind of annoying, but please go through that. And I thank you all for attending, and I will stop sharing.
I have a
And back to
question.
you, Marty. Yes.
I have a question for you, if I could. I
Sure.
had to last year, because of a divorce, go through and get on the marketplace, and so I used the plan finder, marketplace plan finder, and I'm assuming it works somewhat similar to the marketplace plan finder.
Mhm.
And I don't know that. I'm just making an assumption there. But the problem I had was getting the facilities to acknowledge that they accepted the plan. They would say, we
Oh,
accept this
yes.
insurance, but we don't know if we accept this plan. And no one would commit to telling me whether they did or not. And I ended up literally, I was in a hurry. I ended up just buying the most expensive plan
Ooh,
to
yes.
make sure that it covered my primary care doctors.
Oh, I
And
know.
how
Mhm.
do you overcome that issue of when they can't, when or refuse to confirm whether they take that plan or not?
And Melinda, you can jump in here. What I normally do, and I've had the ACA before, I would ask my primary, the doctor I liked and the doctor I wanted to keep, to give me a hard copy of every insurance plan they accepted. And if it
Oh,
was not on there, then I would go to another. I'm sorry, I just would go to another
yeah,
doctor. But it's hard,
yeah,
Marty. It really is
yeah. I
to
called it.
do that. And sometimes they don't know
Yeah, well,
what.
I called their. I mean, they kept transferring me. They finally
Mhm,
transferred me to the business office. No one in
mhm.
there could tell me,
I
and
know.
literally, I had to roll the dice. And so, because I have two in particular doctors that
Mhm.
I highly value,
Yes.
I literally took the most expensive plan,
Mhm.
and just to make sure. And
That you.
that now when I reapply, I don't know. I still don't know which other ones they would accept, and so that was very frustrating.
Yes, it's yeah, it's
Yeah,
very common. And the doctor's offices sometimes they don't know. And that's why I like to ask for a hard copy of every insurance
Yeah,
plan they take.
that's a
And
good,
generally they will provide it. And I'll just go down the list. It's a lot of work, and I see
yeah,
why people, it's
yeah,
just hard. But
yeah.
we here at the Area Agency on Aging, SHIP, we can help you with that. It's difficult.
Well, I need,
And
One
I
one
totally
other
understand.
thing,
Yes,
um,
I'm sorry.
I'm sorry before we move on. Felicia, can you share your screen one more time and
oops,
show how they can go from the Medicare Advantage plan to comparing prescription drug plans? Just that
yes. Okay.
one
Let
tip.
let me go back because you know I have
As
these
we're
two
running
screens.
into Jennifer's time
I
too.
know,
So
and I do not want to do that. Don't
no, we
don't.
definitely want to hear from her.
Oh yeah. Okay. Here we go.
But the
And
question, there was a question in the chat about comparing prescription drug, I mean, in the Q&A, comparing prescription drug plans and supplemental plans. And yes, both of those can be compared on Medicare.gov, but the supplement
yes,
plans or Medigap policies, it's not as detailed because
yes.
that's considered a secondary coverage to Medicare.
Mhm. Is everyone seeing?
No,
We're seeing.
No,
Oh,
mm-mm,
not yet.
shootsies. Okay. Here we go.
you probably have it pulled
Um,
up for you.
I did. I did. I did. I am so
Um,
And
bad at
Maria,
this.
Yeah.
Maria York, I see you're raising your hand. If you have a question or comment, if you could put that in the Q&A. We don't open up the mics when we've got 150 people plus on. It's just too difficult to manage to open up the mic. So if you put whatever you have in the Q&A, that would be
All
great.
right. Okay. I got back to the pharmacies
Okay, just
and so
go to
tell me,
compare,
compare.
continue
Okay.
to view plans.
Okay. Do you want me to click on?
Uh-huh.
Okay.
Continue
Yeah.
to view plans.
Okay. Sure. Let's see. They all hopped in there. I'm just
Oh,
choosing
that's okay.
random.
Yeah,
Okay.
yeah, that's fine.
Okay. And these are
Okay.
the prescription drug plans. Thank you, Melinda.
Oh,
I'm so glad to show
okay.
that. And
Well, I was
go
going
ahead.
to show how to go from Medicare Advantage to prescription drugs. So scroll
Okay.
back to the top and
Okay.
where it says choose a plan to join, right
Mm-hmm.
under that it says prescription drug plans, and then it says switch plan type. So click on that.
Okay. There we go.
And then that's where you can switch from Medicare
Mm-hmm.
Advantage, click on Medicare Advantage, and then
Sure.
find plans,
Mm-hmm.
and then you can toggle that. And so
Yeah.
now it says Medicare Advantage. And so if you switch plan type again, it'll go back to prescription drug plans.
Right.
So
Mm-hmm.
that's how you can compare between Part C, Medicare Advantage, and Part D, prescription drug plans. And then to compare supplemental coverage, that's totally separate. And so once you go back to the main page, or you
Mm-hmm.
don't have to go back to the main page, you can click on health and drug plans at the top
Mm-hmm.
and then find Medicare supplement insurance. And we're not going to actually go,
I
oh,
know.
you click, yeah, there you
Yeah.
go. We're not going to go and compare, but that's how you can
Yes.
compare
Yes.
Medigap policies. And if you
Yes.
do have questions about Medigap, you can definitely contact your local ship and they'll be glad to assist you.
Awesome.
Thank you,
That's
Felicia.
right. Thank you, Melinda. Fearless leader. Here we go. I'm going to stop sharing
Hmm.
and give this back to Marty, and he can introduce Jennifer. I've got my notepad out. I'm ready. And my
Melinda,
pen.
Melinda, you go right ahead and introduce Jennifer.
All
Jennifer's,
right.
yeah, please.
Wonderful. Well, she really needs no introduction. She is one of a kind. I have known Jennifer for, gosh, I don't even know how many years. Probably going on 8 or 9 years. She was the director of the Texas Senior Medicare Patrol, and now is the executive director of the Better Business Bureau Education Foundation. So we are happy to partner with them and have been partnering for a number of years. And so she is the one who I've been working with mostly with the Senior Medicare Patrol, and she is wonderful. And so I want to hear everything she has to say.
Me too. I've got
It's
my
all yours, Jennifer.
You, and it's always a pleasure to present with North Central AAA. Felicia, beautiful job. Beautiful job.
thank you,
Because
Jennifer.
open enrollment, woo. I
Woo.
am getting my PowerPoint up, guys. I don't know why I've been working in Excel, and every time I do that, something goes wonky. So one moment, we're almost there. Right. So let me see if you can see that. And let me go to presenter mode so you guys
It
can
looks
see.
like, there you go, it's coming.
Um,
But
not
let
in
me put it,
presenter mode.
Yeah,
I'm
not,
working on it. I'm working on it.
Okay.
We're almost there.
Yep.
yep.
Okay, and let me switch my screens.
Mm-hmm.
Almost there. All right. Hello, everyone. If I haven't met you yet, it's a pleasure. My name's Jennifer Salazar, and I like doing this presentation once a year because open enrollment is very confusing. I want you to hit the pause button because we're going to take our time. And I want you to know, no matter what we go through, you can always email me. You can always call me. I'm always available. If I'm not, one of my team will be in touch with you. So don't panic. We will get through this because open enrollment, whoo, it's a lot to go through. So first off, let me tell you about the Texas Senior Medicare Patrol. We are federally funded. There's one in every single state, including Guam, Puerto Rico, the Virgin Islands, and even Washington, D.C. So we are in 54 locations. Your Senior Medicare Patrol is located here in Houston, Texas, but we cover 254 counties across the great state of Texas. Now, I've only been to 243 of those counties. Then I got promoted, so didn't make it out to the rest of you guys, but maybe someday. We recruit and train volunteers. I'm very proud to say we finally have about 286 volunteers. When I started here almost 10 years ago, we only had like 31 volunteers. So that's a big improvement. We're really excited. And what we do is we go out and we talk about Medicare fraud, error, and abuse. But if fraud, error, and abuse happens, we have a hotline. We build the cases, we turn them over to the proper control units, such as the FBI, Office of Inspector General. We work with Medicare directly. So we will do everything we can to protect our fellow Texans. Now, I want to establish our roles. So I like to describe the SHIP, which in Texas is the Area Agency on Aging, and the Senior Medicare Patrol is like sisters or brothers. We work a lot together, but we do a different role with open enrollment than the SHIP does. Our mission is to prevent, detect, and report all fraud with Medicare, especially during open enrollment. So it's so important that you know your resources and know who to contact. Now, first off, I know if you guys call Melinda or Felicia and it's fraud, they're going to give it to me and vice versa. So never feel bad about calling a different agency. We will get you to the right people. So for fraud, error, and abuse, you can call us at the Senior Medicare Patrol here in Texas, and I have our number listed. Outside of Texas, don't worry, we have your back. Again, there are 54 Senior Medicare Patrols across this great country of ours, and I have that number listed there. If you need help with open enrollment, enrolling in a plan, you would contact our fantastic SHIP, which is the Area Agency on Aging, or you would call 1-800-Medicare. Let me tell you a little secret, my friends, about 1-800-Medicare. It's 24 hours a day. Because if you're doing open enrollment and you're like, I can't get through, nobody's picking up, everybody's busy. Have no fear. Put that cup of coffee on if your prescriptions allows it. Wait till midnight, call 1-800-Medicare, and guess what? You get an agent, you get enrolled, it's all great. Okay. Now, one way to stop fraud, and I'm going to go through this a little quickly, okay? We're going to have a Medicare history lesson real quick, is to know the difference between the following. Because Medicare is very confusing, but we're going to touch on the differences real quick before we get into the do's and the don'ts, okay? So first off, let's talk about original Medicare. This is Medicare Part A and Part B, known as original or traditional. This was what was signed into legislation in 1965 under Lyndon B. Johnson. And this is your basic Medicare. You have your Medicare A, which is hospital, and your Medicare B, which is medical. This is original Medicare. But let's kick it up a notch. There's Medicare Advantage plans. This is just like Medicare, but it's run through private insurance companies. Now, technically, Medicare Advantage plans have to cover everything original Medicare covers, right? Now, this is Medicare Advantage plans, also known as Medicare C. Now, can you have Medicare Original Medicare with Part C Advantage? No, you can either have Original Medicare or Medicare Advantage. Now, let's take it another step. Then you throw in Medicare supplement policies, which is a Medigap. This covers the gaps in original Medicare, what we were just talking about, Medicare A and B. You cannot have a Medicare Advantage plan and a Medigap policy. And they are also sold by individual insurance companies. Now, let's kick it up a notch, another notch, right? Medicare prescription drug coverage. Medicare, which is CMS, which is Centers for Medicare and Medicaid Services. In our field, we use a lot of acronyms, SMP, SHIP, CMS, OIG. We use nothing but acronyms, but basically Medicare contracts with private companies. So any private company that is selling one of these plans has to get approval from Medicare. They're available to everyone on Medicare unless you're incarcerated. And yes, we've had that question before. Now, if you were released from prison and you have any Medicare, you can get Medicare D. You must join to receive coverage for Part D, which is for prescriptions only. Now, to make it simple, because I like keep it simple, silly. Remember, kids from school, keep it simple. Original Medicare, A and B. Then you can have a supplement or a Part D. So you can have this together. Medicare Advantage plan, you can only have the Part C, which combines A and B technically, and may include a drug program. Now, why am I talking about all this? It'll make sense in a little bit, because unfortunately we have bad actors out there. A lot of times we are in a rush to do open enrollment. We wait till the last minute and we're desperate. And we might be at one of our favorite grocery stores and somebody has a beautiful booth and cookies. I don't know about you, but if I see a cookie, I'm going for my cookie. And they may say, "Hey, you're on Medicare, right?" You're like, "Well, yes, I am. And I want a cookie." "Well, let me get you a supplement." But what you don't know is it might be an advantage. It's going to take you off your original. So that's why I'm kind of going through all this. It'll make sense more in a minute. Now, open enrollment times. Get your pen and your paper ready, but remember, have no fear, your SMP and SHIP are here. So if you get lost with any of this, call us. We're friendly people. We will get to you as soon as possible. But guess what? You have a secret weapon. You have your Medicare and U book, and you may have the internet, and you can always Google this. So when to join a Medicare Part D plan? Initial enrollment. When you're brand new to Medicare, you actually have 7 months. You have 3 months before your birth month, then 3 months after. Now, initial enrollment for Part B, little different. Then open enrollment period for Part D, Medicare Advantage, all of that's October 15th through December 7th. Why did they pick during the holidays? Well, back in 2004, let me take it down a journey. Back in 2005, I was a brand new benefits counselor with the SHIP, Southeast Texas. So if you're on the line, whoop, whoop. Well, anyways, President George W. Bush signed this into legislation that Medicare will now provide a Part D plan for prescription drugs and Choice Advantage plan, known as Choice, right? He and his team thought it would be a great idea to do this during the holidays because you would meet with your family and your family could discuss your drug options. That's why open enrollment's October 15th through December 7th, because it's time to get with your family, your friends, your loved one, your SHIP, and go over your plans. Now, keep these dates in mind. October 15th through December 7th. During this time, when Medicare beneficiaries can join, switch, or drop a plan. Now, do not wait till the last minute. Do not call Melinda and Felicia on December 6th, because more than likely, even though they are the dream team, they might not can get to you. Think ahead. It is a lot of information, but start making plans now, okay? Start October 15th, start looking at your plan options. But remember, you have this amount of time to get to work and pick out the right drug plan. Enrollment and assisting for Part D. Again, if you see fraud, you contact us. But remember, you have your SHIP. You can contact them at this number and they will get you to your local SHIP, which here in Texas is the Area Agencies on Aging. The Area Agencies on Aging are amazing. Their benefits counselors are trained through Medicare, through the Texas Legal Hotline. They're trained. They are ready to help you look at your Part D plans, Medicare plan, Medicare Advantage plans, and Medigap plans. They are there to assist you, but please keep in mind that the help they're doing is paid through a federal grant. Be nice and patient and kind, because open enrollment can be very stressful. These folks in these positions are the best of the best. They will do everything they can to help you, but also be courteous of their time. Make sure you have all your prescriptions ready when you talk to them. Bring your prescription bottles or have them right in front of you, because a lot of errors can happen. For example, Melinda, I don't know the milligram of my statin that I take for my cholesterol. Let's go with 50. Well, guess what? 50 milligrams might be more than 20 milligrams. So make sure you have those bottles with you, okay? Make sure you have your glasses, contacts, readers. I have all of them with you too, because you need to make sure you get that prescription right. You can always call 1-800-Medicare. They can help you with enrollment. Remember, 24 hours a day. If you feel brave, go to Medicare's website. Felicia showed you how to do the plans. Play with it. If you're uncomfortable, call Medicare, call the SHIP. Now, tips to help you with enrollment before we get into do's and don'ts and bad actors. Know your timelines. Again, that is so important, because you have from October 15th through December 7th. Avoid high pressure tactics. For example, you have to enroll today. There is a special deal. If you enroll today, you're going to get your meds 50% off. No. Avoid the high pressure. You have to do this today. If you don't do this today, you're going to lose your Medicare. Baloney. Unfortunately, during open enrollment, you may get more calls than you actually get right now. And it might even say on your caller ID, 1-800-Medicare. It's a lie. They're doing this magic trick called spoofing. They're changing the name of the agency in your phone, right? And they're going to do everything they can to get your Medicare number, because one Medicare number is worth at least $30,000. And the biggest case I ever turned in was, I believe, $36 million. So again, guard it with your life. It's more important than a credit card. When enrolling in a standalone, that means by itself, that means you're on original Medicare A and B and you're linking a D, make sure all your prescriptions are spelled correctly. I cannot emphasize that enough. And I know that it's overwhelming. Original Medicare, Part D, Advantage Plan, Supplement. That's why we're here to help you. But let me tell you a secret. That's also why it's easy for scammers to scam us, because they know this is crazy and this is overwhelming, and it's like playing a Monopoly game, the old board game, on steroids, right? Because there's all these little rules. Compare policy and coverage. And please remember, every plan is different. You would be amazed. When I was a benefits counselor back in the day, I used to have partners, significant others, friends, family, husband, wife come in. They wanted the same drug plan. Well, guess what? My husband is on no prescriptions. I'm on 2 prescriptions. We would not do good on the same drug plan, right? But say if you have a best friend and you want to be on the same plan, going to be different if you're on different prescriptions. Going to be different if you have different doctors, if you're on an Advantage plan. Always check it once a year, because guess what? Plans change every single year. Just because you've been on a plan for 10, 15 years doesn't mean it's going to be the same plan this year. And I know a lot of us are like busy with grandkids, kids, life, family, and we're like, oh, it's fine. I'll just deal with it later. Later will come. And you might think, well, it'll be fine. It was fine last year. Maybe not fine this year. So take the time, do the research. If you need assistance enrolling, don't wait till the last minutes, because you will not get in the right plan. Before enrolling, Make sure the pharmacy you want is in your plan. Ask questions if you don't understand the information. Guys, if you're meeting with anyone outside the SHIP, outside of Medicare, if you meet with an insurance company, ask a million questions. If they get frustrated or annoyed with you, guess what? Fire them, move on, because you are the customer and you are the greatest generation, but speak up for yourselves. You do not have to take anything. If they give you a gift, which they can give you a gift up to $15, don't feel like that means you have to enroll with them. Ask questions. Don't be embarrassed to ask questions, and don't feel intimidated. Move on, walk on, okay? Enrolling in a Medicare Advantage plan. Now, this is going to get a little tricky. Timeline is different. This is only for individuals who are currently enrolled in an Advantage plan, okay? So if you're an original Medicare, this does not apply to you. Your deadline is January 1st through March 31st. During this time, you can switch from one Advantage plan to another. You can drop the Advantage plan and return to original Medicare. You can drop the Advantage plan and return to original Medicare and join a Medicare Part D plan. But if you're already like, oh, Jen, you are really confusing me, have no fear. I'm going to give you our phone number again. You're going to have the SHIP's phone number again. We will get through this. And remember, it's okay to bug us. It's okay to call us. It's okay to ask a million questions. We would rather you make the right decision and feel comfortable than rush into a bad decision. We're there for you. Okay, enrolling in a Medicare Advantage plan. Sorry, SHIP. I'm sorry, Felicia. Sorry, Melinda. Here's their number again, because we only do the fraud side, but I cannot emphasize how wonderful your area agencies on aging are. They are there ready to assist you. 1-800-Medicare is ready to assist you. 1-800-Medicare is wonderful, but remember, they're going to be slammed with calls. So make that cup of coffee, stay up till midnight, give them a call. If you're not comfortable with who you're talking to at 1-800-Medicare or with the SHIP or with the S&P, ask for a supervisor. You're the customer, okay? So take your time. Don't be in a rush. The person on the other line should also take their time with you because you're worth it. Now, here we go. Senior Medicare Patrol is ready to help you. This is what we're going to talk about. Now, I know I went through the history lesson about Medicare and all that stuff, but it built us up for this. Protecting yourself from misleading marketing and marketing violations. Now, let me just say, there are a lot of wonderful, great, good Medicare Advantage agents, insurance policies, supplement policies, supplement agents. They're very, very good. But unfortunately, with everything, sometimes we have bad actors. So what we're going to go through is how to keep you safe. So first off, Medicare, CMS, remember, Centers for Medicare and Medicaid Services, they have rules for marketing Medicare Advantage plan and Part D plan. What does that mean? There are strict rules on how you can advertise your plan, how you can get sales for your plan. These rules are to protect you. The greatest generation are Medicare beneficiaries from aggressive and misleading marketing tactics. Now, when I say aggressive, don't let anybody yell at you. Don't let anybody push you. Just walk away. You don't even have to yell back. Just walk away. If they call you all the time, get an air horn, blow it in their ear. They shouldn't be harassing you. Now, what plans can do, what plans cannot do. And I always feel weird about these slides because over here, what plans can do, maybe one sentence. Over here, there's going to be a million sentences. So plans can send you mail through the United States Postal Service. For example, they can mail you a letter, right? They can mail you a letter. They can mail that to you all day long. If you want the letters to stop, usually there's something at the end that will tell you how to stop them. If you have a fireplace and winter's coming and you need like some firewood, use the letters. Hey, burn them. Don't care what you do with them, but you don't have to do anything with them. Plans cannot call you on the telephone unless you have permission, right? And they cannot send you text messages. They cannot leave you voicemails unless you are already a member and you give them permission. And guess what? Permission has to be in writing. Yay! All right. Did you know plans must provide you the option to opt out of communication, all communication, my friends. They have to give you that option. I'm talking mail, I'm talking calls, text messages, etc., about their Medicare products, period. They have to give you that. It must be done annually in writing. Womp womp. Unfortunately, you have to do it every single year in writing. And you know what? Make sure you send it in before open enrollment because it might take them a while to get to it. Also, before enrolling you into a plan representatives must explain the plan's effect on your current coverage. So for example, if you're on a plan right now and you're going to go to a new plan, the person meeting with you has to review what you currently have. Okay, so if you go with a private insurance company and you decide you want to change to another, they still have to review what you have compared to their new plan. For example, if you have a Medigap, which is that supplement policy that works with a Medicare A and B, a plan representative must explain how you will lose that Medigap if you enroll in a Medicare Advantage. That's right. So if you're on Medicare A and B, which is your original Medicare, you can have that Medigap policy, right? Because it fills in those gaps of Medicare. Because Medicare covers about 80%, and a lot of times you have 20% left over. So that gap helps pay for that. But wait, if you enroll in a Medicare Advantage plan, you're out of original Medicare and you're out of your Medigap policy because you're now on a Medicare Advantage plan. Sometimes people forget to tell you that you think you're just getting another Medicare supplement policy, but you're not. So they have to explain that to you. Here's a secret. If you think you found the plan of your dreams with the agent that you really like, call Medicare, call your ship, tell them, show them, and they can at least give you an unbiased decision. You know, this might work out. Or look at your plan, wink, wink, this isn't the one. Okay. Do your research, but don't sign anything and don't give out that Medicare number. If they say, I need your Medicare number before you enroll, run and call me. Plans can have educational booths, exhibits at public events. Plans cannot ask for your personal information or try to sell you anything at an event, right? Now they can they cannot provide full meals at these events. So back in the day, picture it 2005, I was just married. I'm a brand new benefits counselor. My grandmother wants to go to Papados in Beaumont. And I'm like, Papados? It's not payday and you don't have your check yet. A plan invited her, pulled out the red carpet. I'm talking shrimp, fish, cheesecakes to go. Asked for all of her information. I told her, don't sign your real name. She was Elizabeth Taylor. She wrote down my mom's address and my mom's phone number. My mom still gets the mail. My mom still gets the phone calls. So may my grandmother rest in peace now. Don't give your real information. Do not give out your Medicare number. They are no longer allowed to provide full meals. They did back in the day, but they can do that no more. Plans can call or email you about other health plans and products as long as you are a member and haven't asked them not to call or email. And once again, you got to do that in writing. If you don't want them to call or email you, you got to do it in writing, right? But they can call you if you're a member and you told them it's okay. Plans cannot email you or call you even if you are a member, if you opt out of communication. So you are more powerful than you know. And can I tell you a little secret? When you write that letter to opt out of communication, just put CC, copying, Senior Medicare Patrol. Whoop! Because guess what? Now we have it on file. If they keep contacting you, I can have our hotline specialist, who is amazing, Eloisa, say, hey, we have this on record. Why are you bugging our people? Okay, use your power. Plans can, and this is where we go, woo, schedule an appointment to discuss plan options with you. But, and it's like Monopoly again, okay? There's lots of rules. Before the appointment, you must formally decide which topics you want to discuss. Because guess what? You are in full power of the conversation with the plan. The appointment must occur 48 hours or more after it's scheduled, unless you walk into their office or it's the very end of open enrollment. More rules, right? The planned agent must stick to the topics you agreed on in advance. The plan agent may not use your appointment or the time before or after to market or sell to other people in your building or neighborhood. Example, back in 2006, 2007, we used to see people, unfortunately, in like assisted livings, nursing homes, federal subsidized housing. Everybody's on the same plan. What? Not everybody takes the same prescriptions. Not everybody does that. That's because agents used to say, hey, introduce me to your neighbors. Would they like a pizza party? Wonderful. Well, let me tell you about my plan. What's your Medicare number? Everybody got signed up. Okay. This is to protect you. They cannot ask who are your neighbors are. They cannot ask, hey, can I get a list of your personal friends? Da, 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 da. No. If they ask for any of those are red flags. No, 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 no. Plans cannot approach you in public areas such as parking lots, hallways, or sidewalks. No. They can give you prizes worth up to $15. Cannot be like gift cards, cannot be in forms of cash, and cannot require an appointment. Now, let me tell you a little secret. Say if I am a plan agent and I'm doing a presentation at your community center, and I have these cute little presents, right? Like I have these cute little mugs. Shout out to San Antonio Bear AAA. I have these cute little mugs, and everybody's going to get a mug. But wait a minute. There's 80 people in the audience, right? I only have 76 mugs. I can't give out one of those mugs. I have to give them out to everybody in that audience, period. It's all or nothing. Conduct promotional activities worth over $15. They are not allowed to go over the $15. For example, if you do a raffle prize at an event for 10 people, must be valued under $150. So it gets kind of wonky there. A few more steps to keep you safe because we're all about safety. Now, especially during open enrollment, watch out for anybody that asks for your Medicare number, your Social Security number, definitely your bank information, especially before you decide to enroll. One trick, unfortunately, bad actors will use is they will do an intake form saying, I need your Medicare number. I need all of this before we meet. That way I can do a custom search for you. I need you to sign here. No, okay. That is so huge. Now, if you go to your AAA, they have procedures to keep you safe. They may ask for your information to pull up your stuff, but they are safe. You contacted them, you're meeting with them. But if you get a phone call and it says Medicare or a plan name or something, and they're asking for this over the phone, hang up, hang up, hang up, because I'm telling you, it's not worth it. It's probably fraud. Someone can use your information without your permission, so they can actually enroll you into a plan. You won't even know about it. Let me tell you what's going to happen. You are going to go to your pharmacy. Me personally, I use HEB, okay, because it's 1 mile from my house. And say if Jennifer goes and gets her prescriptions, let's say January 15th, and my Civastatin for my cholesterol is usually no cost to me because of my insurance, right? But Jennifer goes to pick up her prescription at her local pharmacy. It's $190. Jennifer didn't know that happened. Guess what happened? Jennifer met with an agent because she saw cookies at her local grocery store. And the agent's like, come sit with me. Let's talk about this. I'm like, oh, this is great. Well, let's run your information. Sure, sure. Can I get that box of cookies? Absolutely. Well, let's get your information. Oh, here you go. Yep, thank you. Jennifer does not realize she just signed up for a Medicare Advantage plan. They didn't tell her. They just did it. Be careful. If you end up in this spot and you find out January, February, March, April, call us. Call Melinda. She'll get you to us. We'll work with Medicare. We'll do everything we possibly can to get you a special enrollment period. But be safe. If they say, oh, I can't give you this blood pressure machine without your Medicare number, run. Okay. Now, remember, and I keep saying this over and over and over again, never give your Medicare information to anyone but people you trust, like your healthcare provider in person. Never give out that Medicare number because, again, guys, it's worth $1 million. There's some new scams going on with the Medicare cards. They never stop. But no, Medicare will never send you a plastic card. No, just because it's open enrollment does not mean you're getting a new card. If your card is, if somebody does steal your card, a lot of times Medicare will not replace it till you see charges on your Medicare summary notices. Please always check those Medicare summary notices. If you see anything that looks weird, odd, call us. We'll research it. For example, an 82-year-old gentleman in Anahuac, Texas should not have been tested for pregnancy. We've seen it all. We've dealt with it all. We're ready to help you. So watch out for people that say they represent Medicare. I can't even say I represent Medicare. I don't work for Medicare. I have a federal grant. The Senior Medicare Patrol is a federal grant. I work for the Better Business Bureau Education Foundation. I cannot say I'm with Medicare. Melinda cannot say she's with Medicare. Marty can't say that. Nobody can say that unless you are actually with Medicare. Plans are never allowed to state they represent are endorsed by Medicare. You know how like sometimes people say endorsed by this, da, 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 da. They can't do that. So watch commercials. Get ready. Call me. Let me know what commercials are saying that. They're not allowed to say that they are endorsed by Medicare or any government agency. So during open enrollment, Cherie Story, who's our volunteer manager, and Angel Hansick, who's the director now, will actually let me know of people trying to become volunteers for the Senior Medicare Patrol. And guess what? A lot of them are insurance agents because they want to become one of our volunteers. And then they want to say, we work for the S&P. We volunteer for the S&P. No, we're not even allowed to have agents, healthcare providers, home health agencies. We're not allowed to have any of those part of our program because it's a conflict of interest. Be very cautious. Also, they're not allowed to use the Medicare name or logo on any of their marketing materials. If you see it, report it. Let us know. We work closely with Texas Department of Insurance, the Attorney General's office, because it's no-nos. Watch out for people who send you unsolicited text. What does that mean? You didn't ask for it. They still did it. Plans must provide you the option to opt out of all communications. We've been talking about that. Remember, do it in writing and use your little trick. Copy Senior Medicare Patrol, because when you do, they won't bother you. And if they do, call me. Watch out for people who offer you gifts to enroll you in their plan. So if they say, oh, I'll give you that box of cookies, it's not worth it. Keep walking. Ignore it regardless. And they can't give you anything over $15. It can be $14.99. It can be $15.00, but it can't be $15.01. Now, this is one of the biggest things we deal with every year. No one can pressure you to enroll in their plan. If you feel pressure, walk away. Don't be embarrassed. Just keep going. You can use the entire time, October 15th through December 5th, or December 7th, to enroll into a plan. You have that entire time. Don't wait until the last minute, because unfortunately we all get busy. We can't get to you like we want to. And remember, 1-800-Medicare, call them late. You can do this, I promise. You will not receive extra benefits for signing up early. That's one of my favorites. One time we had an agent out there saying that if you sign up early, you also get discount cards and you get all this stuff. There are a lot of discount cards out there. There are a lot of cards out there. I'm not gonna lie. If you look in my purse right now, I've got Kroger, CVS, Walmart, Walgreens. I've got them all because I want my discount and I want my points. But check them out. Make sure they're legitimate. Guess what? I also work for the Better Business Bureau, whoop, whoop, in Houston. I can check it out for you. I can also contact another BBB and we can check all that out for you too. So we're a one-stop shop to help you. These are scams we have seen through the years with open enrollment, and it always starts with communication. Watch out for phishing, and yes, I spelled that right. It's not the kind of phishing I like to do. Fake emails. So you may get a fake email and it may say Medicare open enrollment. What you want to do is you want to take this little guy right here. I don't know if you can see my mouse. Take your mouse, put it over the address of the email address, who sent it to you, and give it a few seconds. And if it says go Apple bananas 123, scammer. Also, these could be scam. If you're unsure, send them to us. We'll take a look. We'll let you know. Watch out for fake ads on social media and imposters. Also, just a tip, if you're watching those commercials or if you're on social media and your favorite athlete, figure skater, singer, if they're telling you about a plan and to enroll in that plan because it's the best plan, please keep in mind, yes, we might like their music, we might like their sportsmanship. They may not be on the same drugs you are on. They may not go to the same doctors you go to. Like Felicia was talking about counties, they might not even live in your county. It might not be a good fit. So just because your favorite person's endorsing it does not mean it's right for you. Watch out for calls, texts, scammers pretending to be Medicare. Medicare's not going to call you. So back in the day, I used to say the Queen of England, may she rest in peace, is going to call you before Medicare. So now I have to say the King of England would call you before Medicare. It's not going to happen, friends. They're not going to call you. Also, we live in a day where door to door, knock, 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 sells. You shouldn't be coming to my door to sell me anything. I've got Amazon. I can drive anywhere. I can have things delivered. Why are you coming to my door? Watch out for door to door sales. And I don't want to hear, oh, I was in the neighborhood. Well, keep walking. And you don't have to answer the door. You don't have to pick up the phone. You have more power than you know. Recommendations. So don't open any links and emails until you verify who they are really from. Just because it says Medicare, remember, it may not be Medicare. Check it out. Don't let strangers in your house or stop you on the street. I know that sounds crazy, but you would be amazed if like agents are walking in your neighborhood and you think they're an Advantage agent, or if there was a natural disaster and you think that they're with FEMA and you're like, oh, just come in for a second. And then they're like, oh, wait, we want to show you something or whatever. They can rob you. There's a million things that could go wrong. Don't let people in your house, even if they're nice. No, I'm sorry, but we got to get tough. We got to say no. If I can say no, you can say no. Don't pick up the phone or answer texts from strangers. If they say they are who they are, call them, verify, like the grandparent scam. Have a password or a code word like, grandmother, is it you? Well, yeah, it's me. Da, 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 da. Well, how's your cat? Well, your grandmother's allergic to cats, but if it's a scammer, they don't know that. Or have a code word. When my grandmother was alive, her code word was Johnny Depp because she loved him. Okay. Don't trust your caller ID. This thing is a blessing, but it's a curse. Don't trust it. Now, scams of Medicare open enrollment. Scammers will represent themselves as government officials. These thieves contact seniors by phone, email, or coming to your door. They're going to pretend like they're with Social Security. They're going to pretend like they're FBI. They're going to pretend like they're Medicare. They don't care. They just want your Medicare number because, again, you might have, like me, it's not payday yet. I've got maybe 25 bucks in the bank. So, but my driver's license number is worth 30,000. Your Medicare number is worth 30,000. So yeah, you might think, well, they're not going to get nothing from me. Yes, they are. Trust me. Also, scams to watch out for. We've seen this every single year. Gosh, this one just doesn't go away. You get a call and they're basically saying they're an Advantage plan or they're with Medicare and they want to send you a great deal. You can get all your meds, all your coverage, everything for $299. Wrong. Keep moving. You receive a call saying that you're going to get something from last year because you overpaid and they just need your bank account information to wire the money. Yeah, if you give it to them, you're going to be in the negative because they're going to take your money. And again, they're going to try to sign you up for a plan that isn't right for you. Again, have your prescriptions ready. Make sure they're spelled correctly. Bring the bottles. Don't be embarrassed. Make sure the milligrams are right. You want to make sure you get in the right plan. Plan early because, again, you have this whole amount of time. You have October 15th through December 7th to make a good, solid decision. You don't have to make the decision October 15th. You can wait till November 1st, but take that full time. It's okay to review plans over and over again. I highly encourage getting with the AAA, Area Agency on Aging. They are wonderful at helping you. Also, I'm almost done, Marty. If you receive a call, especially from a number you don't know, hang up. If they ask for your Medicare number, get that air horn, blow it in their ear, walk away. And again, the numbers, if you need anything, call us at the Texas Senior Medicare Patrol. Our number is 888-341-6187. If you're outside of Texas, we still love you, but we can't help you. So it's 808-2468. Remember, you're not alone in open enrollment. I know I went through this quickly, but guess what? You have allies. We are there for you. We want to help you, and don't let anybody push you around. That's
Okay,
it.
I want to make sure that I say, Jennifer, Disney Pixar has missed picking you up. Somehow I have not believed they have not discovered you for Disney Pixar
How do you
because
say
you
that?
do an incredible job. The BBB is so blessed to have you. You're so animated and you do a great presentation. Seriously.
Thank you, Marty. That means a lot coming from you. Thank you. And you know
Seriously.
what? It's always a pleasure getting to see Felicia and Melinda because I don't get to, I miss my
No,
benefits counselor friends
I
because
know.
they keep me chained to my desk.
Let me real quick go over the CEUs for the people that have to get off
Mhm.
because of time. Real quick, I want to go over the CEUs. We're providing complimentary CEUs today for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process. And I actually encourage you to go through the process, get a certificate, and submit it to your jurisdiction and see if they might take it. I have had many people tell me they've been able to use them, but please note there is no guarantee. We also have certificates of attendance available for anyone that would like or need one of those. A lot of times I know people's jobs ask for them to justify their time. Today's webinar is worth 1.5 hours of CEU credits. You must have completed the entire live webinar and the Q&A up to the advertised time of 2 minutes ago. And so then you must also complete the Google survey. The evaluation survey should pop up as you close out of Zoom today. It should just ask you if you would like to take a short survey that will take you directly to our Google survey. If that does not happen, no worries. Some companies have pop-up blockers that won't allow that. The survey will be emailed to you sometime late tomorrow, so you can take it at that time. And don't worry if you can't remember if you've taken it. If you took it the first time, take it again. It's not a problem if you take it more than once. The Google evaluation survey link will be up for a week, and please give us about a month to get the surveys to you. I will note that I am quite a bit behind. I don't believe I even have last month's Medicare Monday certificates out yet. I've been traveling for the last 35 days. And so when I get back in my office next week, we'll get caught up on our surveys. So I'm going to take it from there to, hold on. Oh, I'm sorry. I thought I had it. I had it
Okay. Well, my
just
fingers are hurting.
I just want one deal to ask about the last. Dang it! I had it on. It's closed. No. Okay,
Uh-oh.
I'm sorry. I had. I don't know why it showed next month. Would you? What do we have on net for next month? I had it on my slide.
Oh my, I have it.
I
It
have it.
will be Leslie on November the 13th.
New
What's new in
changes. Yep.
what's new in
Hmm.
2026? And
I'm glad I'm not
Thank
doing
you.
that one.
Thank you. I thought I had
yeah.
that pulled up. I thought that's the one I had pulled up. I am so sorry.
Are
Thank you
you
for
doing
that.
that one, Jennifer? Are you doing
No, but
one?
Yes.
Oh,
you guys have one in December, right? Because I'm doing holiday scams and I got my
oh,
Oh,
that,
ready
all
for that.
right.
yes, yes. Okay.
We're
Open
gonna have you
enrollment,
back.
holiday scams. That's my, no, nobody else gets to do that. I'll cancel everything for those.
I love that one. I
Love
do
it.
too.
Love it.
The Grinch.
Oh yeah, we'll have the Grinch game. Don't worry.
I love that. I
That
love
is
that.
wonderful. That is
Mhm.
wonderful. Well, I've been answering questions in the Q&A. My fingers are sore, but
Oh no.
great questions that people had. And I was like, wow, I didn't think there would be so many questions, but it's good. One of the questions, and Jennifer, I think I'll post some of these to you because I'm sure you probably will have a good response. Why do they seem to push advantage plans? I wanted to give my opinion, but I thought I better not.
So again, this is from our perspective, and I'll just be honest with you. I'm going to put on my benefits counselor hat, which was 7 years, and my S&P hat, which is 10 years, so 17 years of what I've seen. Unfortunately, I believe my personal opinion, every person that an agent enrolls is commissioned. So, again, there are good people out there doing a great job and want to help, but they do make commission because they do have to make a living, right? And unfortunately, you do have bad actors in that. That's why the SHIP and the S&P, the area agencies on aging, we can't allow certain people in our programs, even though they may be wonderful. We may go to church with them. You might have kids with them, or not, you know what I mean? You might run the youth club with them, right? I mean, that's not wrong, but they might be wonderful sisters. They could be like your family members, but they make commission. Okay. They make commission. And not just that, not everybody, now they're supposed to be properly trained, but not everybody gets the training they should receive. And not everyone learns correctly. One time we had this person that really believed they were doing the right things, and it turned out they weren't trained properly. So it's a million things, but the biggest thing is report it. Don't feel bad when you call us. We're not the police. We can't go make arrest, but what we can do is we can work with Medicare, we can work with the right agencies. We can get that person the proper training, but we don't want anybody to, fall victim, because that's your prescriptions, that's a lot of money, that's your doctors, that's everything right there. So that's why a lot of people can be pushy in those plans, unfortunately.
Yes, yes. I could, yeah. I wasn't going to be as nice. Okay.
Nicely as I could.
All right. This is one if I turn 65 in August of 2025, I do not enroll in a prescription drug program until October 15th through January
That
7th.
was
That's a no.
that was from me, and
Right, right.
unfortunately,
I,
it won't let me type in a question in the Q&A. But
yeah.
unfortunately, I turn 65 next year in August. But they said you don't. Did I hear that right? You don't do
No,
your.
that's not true. That's not
Okay.
true.
In
So if
trouble.
you turn 65 in August,
Count 3 months back.
you have 2 months from that time prescription drug coverage. You have to have prescription drug coverage within 63 days of signing up for Medicare Part B. So if you wait until October 15th through December 7th, that plan will not start until January 1st. So therefore, you would be without prescription drug coverage for more than 63 days.
There was something that was said that you don't do during that. I understand it's 90 days before and 90 days after your birthday, right? So you have, but I thought someone said in the presentation there was something you did not sign up for during that period, and I thought it was an advantage, and maybe I just didn't hear it right.
No.
I'm not sure, but if you the open enrollment period, October 15th through December 7th, is for someone that's on Medicare. So if you're starting in August, then October 15th through December 7th, you would be looking at plans for next year, for the following year.
Okay, I would like to make an appointment with
that's what I was going to say.
Of you for what is 30 days, what is 60 days or 30 days before, or I guess it's 90 days before August 20th next year. I'll get all of you on it.
You'll get it.
Oh yeah, we'll be right here. We'll be right here, ready to
Lord willing,
help
Lord
you.
willing. Yes,
I got a couple
I'm
more.
Tell you, I listen to these every year, and it is confusing. It really is.
Oh yes. Oh yes. It is. It is. Okay. If during the meeting a non-related issue, this is a meeting with an agent or broker. If your question comes up, can they discuss at your request, or would you need to schedule a follow-up meeting? I'm thinking either or. If you're requesting it, they can discuss it, but they're going to have to go through what they came for first. You know, they have that time allotted. So I would think if the time permits, they would be able to discuss at your request. If not, then they would schedule a follow-up meeting.
That's where
Jennifer, any?
that's where things get really dicey. I mean,
Yeah.
it really does, unfortunately. And honestly, again, it depends on the agent, it depends on the training. For
Mhm.
example, you're supposed to basically talk about what you're supposed to talk about during the meeting. But again, and that's where when possible fraud happens, he said, she said, the dog said, again, you have to be so careful. You just do. I'm just telling y'all. And we're in Texas. Tell him, hey, I'm going to record this to make sure I understand. I'm 44 years old, about to be 45. When I go to my doctor, I'm like, I have white coat syndrome. Doctors scare me. I always tell him I'm going to record this so I can understand it later because I'm not, I'm here for my results or whatever. Tell them. Don't be embarrassed if they say no. That's a red flag. Record it. Also, Felicia said something wonderful. I write everything down. I'm always writing. I have like a million of these. Don't feel bad about writing. Don't feel bad about recording. That's your word. That's everything. So, because unfortunately, when we're doing this stuff, he said, she said, the dog said, protect yourself.
Mm. Okay.
Period.
Yeah. All right, Jennifer,
No.
you said plan, in quotes. Does that mean independent insurance agents or the actual Advantage Plan insurance companies?
All the above. All the above.
That was easy.
Yay. I like that. Yes, no, or all the above.
All right. When do you expect them to release the updates to the premium for Part B and the cost of living increases for Social Security? Next month.
Fingers crossed.
With everything that's going on, we don't know for sure. And so it's really hard to say. Usually it's around November that it's released. With the shutdown, that may change when that information is shared with us. There is a there are projected figures that are out there, but we have not had a final word on that.
Us too, Melinda. We've seen the projections, but we don't have the confirmations. And again, great answer because we don't even we don't know.
We don't know. We don't know.
Right,
All of us
right,
were- And if I know, you know, and if you know, I'm gonna know.
right, right.
And we'll tell Marty later.
All right.
No.
Somebody asked about the slides. Those were in the chat several times, and then it will go out in a follow-up email. So
Yeah,
you
that will
should
be in
get those.
yes.
And I think one other question, I think I got all, oh, can you get Medicare Part A and decline not pay for Medicare Part B, but still get Medicare Part D? Felicia, do you want to answer that?
I'm sorry.
Or should I?
I
Oh.
you go ahead. I just drifted off. I'm
Say
sorry.
all the above, it won't work.
All right. So someone can have just Medicare Part A. And if they have Medicare Part A, they can get a standalone Part D prescription drug plan. So you don't have to have Part A
Yes.
and Part B. If you have other coverage, medical coverage, and you're over 65, then you're good. But if you're over 65 and you don't have other medical coverage, you could be penalized when you do sign up for Part B. And oh my goodness, they're still coming. Oh no, wrong one.
You'll never
Can a
have to back
person
again.
Can a person sign up for Medicare during the open enrollment if their 65th birthday falls on February or March, or will they have to wait until December? When someone turns 65, they can start looking into what they want to do 3 months before their 65th birthday. So that way, the month they turn 65, the first of that month normally, they will start Medicare. If someone's already on Social Security, they'll automatically get that Medicare card. If they're not on Social Security, then they would contact Social Security Administration to get started with Medicare. So they would not have to wait until December. I would suggest contacting your local SHIP to get more information. Are you recommending to go through SHIP for enrollment for Medicare Part B and D instead of going through licensed insurance professional due to they might be biased?
So
We are suggesting contacting your local SHIP to get information about your options. For enrollment for Part B, you would actually go through Social Security Administration. They will help you enroll in Part A and B. As far as the other options, we can provide information to you and help you get enrolled.
I do want to say something to that, Melinda, if you don't mind.
No, not at all.
There are wonderful agents out there. We're not talking bad about any agents. There are reputable companies on the Plan Finder. If you're brave to go on there, you can look up the ones that have the ratings and everything. But the one thing you do get with a benefits counselor with 1-800-Medicare is they're unbiased. You know, for example, and this is silly, but like my kiddo, she has a science fair every year and they want me to judge it. And I'm like one of the only parents that won't, because she's gonna win, you know, because I'm biased. You have to go with something, you know. So trust your gut, meet with more than one agent. And just because they go to worship with you or they live in your neighborhood doesn't always mean it's the best deal. So just always check it out. You're not on the same prescriptions, and they will understand that because they'll want what's best for you.
Right.
Okay.
But we're not
All right.
bashing agents at all. We're just saying.
Right.
Don't say Jennifer Salazar said, say Jessica Think does or something. But yeah.
Okay,
Yes,
two more
so
questions.
let's see.
Two
And
more.
I'll take the last one for
Okay.
you. Okay. I don't.
All right. How do you pay the Part B premium if not on Social Security? You would pay quarterly directly to the Social Security Administration. You can have it automatically drafted from a bank account. If you actually go online to Medicare.gov and create an account, they will allow you to pay monthly with auto pay. So that's new in the last few years that they allow someone to pay monthly if they're not on Social Security. And the
Okay.
last question.
Wonderful. Yes. If you signed up for Medicare Advantage and later want to change to traditional Medicare, are you allowed? Yes, you are. If you choose a Medicare Advantage plan and January 1 through March the 31st, you can change that back to original Medicare and a supplement if you choose to, and a prescription drug plan. Yes, you can do that.
Right.
Y'all,
And the only caveat to that is Medigap or supplement insurance may not be guaranteed. So
Exactly.
it may not be something that you can
You can
automatically sign up for if you're
Mhm.
not in an enrollment period for Medicare, Medigap policies.
Right. And it might cost a little more.
Yes.
but and that cost is ongoing, isn't it? It's a penalty, isn't it? And it goes
Well,
on
not
for life. It doesn't just go
well,
on for.
well,
Not with the
Medigap
Medigap.
doesn't have a penalty, but you may pay higher premiums.
Yes.
I see.
Yeah.
I see.
It'll happen one
Mm-hmm.
way or another.
Right.
I mean, I'm sorry, but
These were great questions, and we
Yes,
appreciate
they are.
all who stayed on. So thank you
Yeah.
very much.
Yes.
Make
Yeah,
sure and
Jennifer.
share this information.
Yeah, and it will be up on the website in the next 4 days. It will be up on our YouTube channel for you to go back and relook at and share. Melinda, Felicia, Jennifer, thank you so very much. It was
Thank you,
just
Marty.
a great presentation. We appreciate everybody for joining us, and you all have a wonderful day. And know that only 6 days until the 15th. And so you better hurry up and get on there. You better hurry up and get on Felicia and Melinda's
Don't remind
calendar.
us.
You better get on their
Denial.
calendars quick.
Oh,
Okay, take
All
All
care.
right.
right.
Thanks all. Have a
Uh,
good day.
It's good
Okay.
seeing you guys.
Bye. Good
Good
seeing you
seeing you.
too.
Yes.
Bye-bye.